According to the World Health Organization, mental health is a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well and work well, and contribute to the community. It includes our emotional, psychological, and social well-being, and it affects how we think, feel, act, and make choices, and relate to others. Mental health is a basic human right for all people. Everyone, whoever and wherever they are, has a right to the highest attainable standard of mental health. This includes the right to be protected from mental health risks, the right to be available, accessible, acceptable, and good quality care, and the right to liberty, independence, and inclusion in the community. As mentioned, mental health is a complex continuum, for this is experienced differently from one person to next. It varies for the difficulty and distress in different social and clinical outcomes. What you may experience currently in your mental well-being may be different to others. We all have our own struggles. Every day we fight our own darkness, and it varies per person. Mental health includes disorders and psychosocial disabilities, as well as other mental states associated with significant distress, impairment in functioning, or risk of self-harm. Psychosocial issues are events or disruptions in a person's life, such as housing concerns, financial matters, domestic abuse, grief and loss, isolation, and other factors specifically related to mental health, depression, anxiety, and adjustments. Psychosocial issues can be further defined as conditions or problems in personal, social, occupational, and environmental domain, as well as those related to physical and mental health. A lack of understanding and sensitivity towards psychosocial issues can influence patient responses to interventions. Some of the major psychosocial issues are family problems, depression, anxiety, substance abuse, sexual abuse, and violence. But around the world, the most common psychosocial issue is depression. 1 in every 10 young adult Filipinos suffer from major depressive disorder. According to the World Health Organization, depressive disorder, also known as depression, is a common mental disorder. It involves a depressed mood or loss of pleasure or interest in activities for long periods of time. People suffering from depression usually has their symptoms lasting 2 weeks or sometimes longer than that. You might feel bored or sometimes lost interest in doing the activities or things that you like or love the most. You'll feel a sense of emptiness, like you don't know why you're not enjoying it. It's not like you don't like it, but you feel rather empty inside. People who suffer from depression feel a different kind of sadness. They may struggle opening up or explaining the kind of sadness that they feel. There are some people who suffer from depression who feel and blame themselves for things that are sometimes beyond their control. They feel guilty for things that did not happen, or if it happened, they blame it on themselves. How do we address and approach depression? Learn as much as you can. Try to understand what causes and triggers it. Finding the right treatment takes time. It might take some trial and error to find the treatment and support that works best for you. For example, if you decide to pursue therapy, it may take a few attempts to find a therapist that you really click with. Other treatments, including exercise and therapy, can be just as effective as medication, often even more so, but don't come with unwanted side effects. If you do decide to try medication, remember that medication works best when you make healthy lifestyle changes as well. Get social support. If you are feeling stuck, don't hesitate to talk to trusted family members or friends, or seek out new connections at a depression support group. Asking for help is not a sign of weakness, and it won't mean you're a burden to others. Often, the simple act of talking to someone face-to-face can be an enormous help. Treatment takes time and commitment. All of these depression treatments take time, and sometimes it might feel overwhelming or frustratingly slow. That is normal. Recovery usually has its ups and downs. Other ways in how we can address depression are focusing on self-care. Control stress with activities such as meditation, eat healthy, exercise, and get enough sleep. Most adults need 7 to 9 hours of sleep per night. You can also avoid using alcohol and substance abuse, which can worsen symptoms and make depression harder to treat. Set small and achievable goals. Set realistic goals to build confidence and motivation. Know the warning signs. You can also ask for help and recognize your depression triggers and talk to your doctor or mental health professional if you notice unusual changes in how you feel, think, or act. You can also write down how you feel day by day, your moods, feelings, and reactions to spot patterns and understand your depression triggers. You can also educate your family and friends about major depression. Seek support. Whether you find encouragement from family members or a support group, maintaining relationships with others is important, especially in time of crisis or rough spells. Stick to your treatment plan. Even if you feel better, don't stop going to therapy or taking your medication. Abruptly stopping medication can cause withdrawal symptoms and a return of depression. Participating in self-management education program can help patients manage depression and take control of their symptoms. At the end of the day, we are the ones who's responsible for battling depression. The counseling, therapy, medication, support groups are there to help you. But in the end, we must also help ourselves. It will take time, but eventually we will be okay. Let's talk about suicide. For some, the word suicide can make them feel uncomfortable. For others, it may bring up strong emotions. One thing for sure is that we need to remove the stigma around mental health and suicide, as it is more prevalent than you think. Did you know that more than 700,000 people die due to suicide every year? Suicide is the fourth leading cause of death among 15 to 29-year-olds. 77% of global suicide occurs in low and middle-income families. Suicide is linked to mental disorders, particularly depression and alcohol use disorders. And strongest risk factor of suicide is a previous suicide attempt. The Suicide Prevention Resource Center defines risk and protective factors and warning signs. Individual, relationship, community, and societal factors can increase the risk of suicide, such as previous suicide attempts, history of suicide in the family, substance abuse, or mood disorders. Warning signs indicate an immediate risk of suicide, often talking or writing about death or dying, making comments about being hopeless, helpless, and worthless. Expressions of having no reason for living and no sense of purpose in life. Protective factors are characteristics that make it less likely that individuals will consider, attempt, or die by suicide, such as contacts with healthcare professionals, effective mental health care, easy access to a variety of clinical interventions, feelings of strong connections to individuals, family, community, and social institutions. How to support someone with suicidal thoughts. Here are the 5 action steps for helping someone in emotional pain. First is ask them. If you think that someone is struggling, please reach out to them. Let them know that they are not alone and that they can talk to you. Don't be afraid of asking the question, are you feeling suicidal or are you having thoughts of ending your life? Then stay calm and be supportive. And try to reassure them and avoid phrases such as snap it out or you should be grateful for the life that you have. Also keep them safe. Stay connected. follow up, and stay in touch after crisis. To anyone out there who's hurting, it's not a sign of weakness to ask for help. It's a sign of strength. It's okay to be scared of what lies ahead. You are not alone in feeling this way. Everybody's talking about self-care these days. Self-care means taking the time to do things that help you live well and improve both your physical health and mental health. Taking care of your emotional well-being is just as important as taking care of your body. We probably talk about good nutrition, the importance of good night's sleep, practicing gratitude, setting goals and priorities, focusing on positivity, staying connected to family and friends, the importance of physical activity and relaxation, and maybe even focus on some mindfulness skills. What springs to your mind when you think about self-care? To know more, here are some types of self-care that you might consider. Emotional self-care. Processing emotions can be hard to do. When negative emotions spiral out of control, they can impact an individual's personal and professional relationships. Emotional self-care activities include gratitude journaling, therapy, meditation, and similar techniques. Mental self-care. Mental stimulation such as learning things can help with the person's energy and outlook. Activities may include reading a new book or listening to a podcast. You can also try doing brain teasers or trying out a new hobby. It can also be as simple as enjoying a ride. Anything that gets a person out of a mental rut can be empty. The expression a sound mind and a sound body may be old-fashioned, but it's a core principle of physical self-care. Examples of physical self-care include adopting a healthy diet, exercising regularly, and getting plenty of sleep. Physical self-care will be different for everyone. It's most effective when an individual identifies their goals and the steps they want to take and to achieve them. Next is social self-care. According to the Centers for Disease Control and Prevention, or CDC, loneliness and isolation are associated with higher rates of depression, suicide, and death. For many people, relationships with friends and family can be a nourishing source of mental and emotional well-being. However, relationships can also be a source of stress and unhappiness. Social self-care is complicated. Activities that may work for one person, such as weekly calls with a parent, for instance, may be completely wrong for another. Spiritual self-care. Not everyone has a spiritual or religious need. However, for many caregivers, whether they are social workers, nurses, or other clinicians, a spiritual practice can provide comfort and strength. Paying attention to and tending to one's spiritual needs, such as through regular prayer, meditation, or meetings with a spiritual advisor, is often part of an effective self-care plan. Professional and educational self-care. School and work responsibilities can be overwhelming at times. Trying to manage all of these obligations can be a source of so much stress, even in a fulfilling job or degree program. Taking the time to learn best practices such as setting goals, using time management techniques, and setting boundaries can help an individual in handling these pressures. Next is financial self-care. Financial pressures are a common source of stress. Taking control of their financial matters can help an individual alleviate some of the anxiety they may have regarding their financial stability. Although beginning to practice these types of self-care activities may feel stressful at first, over time, financial self-care can result in peace of mind. Financial self-care tips include setting a budget, identifying goals such as paying off bills, setting a savings account, budget for travel, or emergency fund. After finding out the types of self-care, you might find some benefit in creating a self-care plan. To create a plan, you need to start by asking some questions. What have you enjoyed doing or having in your life in the past when things were going well? What self-care strategies seem to work for the people around you? What things do you think you would like to try? Think about the things that might benefit your mind, your body, and your spirit. Maybe you are neglecting one particular aspect of your life. Perhaps that's the area that it would be worth focusing on. When you've answered those questions, you'll have a nice long list of possibilities. Take a closer look at it. Cross off the strategies that you know won't work for you or not possible at the moment. From what remains, choose the strategy that looks the most possible, the most appealing, or that you feel you need most. Then make a plan to try it out for a couple of weeks. Developing a self-care plan takes a little time and effort, but it's worth doing. Practicing self-care can better equip you to deal with the crisis and the difficulty of aiding someone. Engaging a self-care routine has been clinically proven to reduce or eliminate anxiety and depression, reduce stress, increase happiness, and more. It can help you adapt to changes, build strong relationships, and recover from setbacks because self-care is a necessity for everyone. Have you experienced extreme life challenges? Loss of loved ones, experienced a natural disaster, sudden financial loss? Maybe once in our life we have experienced these events, and it may have affected us in some way. And stress is one of the common reactions we may feel in these uncommon situations. Some people will have severe reactions following a stressful event, and it may need some help for them to be able to find relief from this situation. And this is where psychological first aid is needed. Psychological first aid is a set of skills and knowledge in creating an effective tool to help people that may have experienced extreme distress. This could assist people to feel calm and facilitate them in coping with their concerns. The goal of psychological first aid is to promote an environment of safety, calm, connectiveness, self-reliance, and hope. This may be an intimidating thing to do, but as a human being, it is our nature to help others. Here in the Center for Guidance Services, we can provide tools to become an agent of help by providing these practical steps in providing psychological first aid. First, make a connection with someone who experienced distress. Make the first move, especially for someone who just experienced distress. They are not immediately comfortable to talk about their concerns. Introduce yourself and ask permission to talk. Ask about their immediate needs. Are they in need of food, water, fresh clothes? Make sure that they meet their basic needs. Present with an air of patience, compassion, and calm. Don't approach too closely or touch them if you're not familiar with their cultural background or personal preferences. Consent is always the key for a meaningful relationship. Protect their confidentiality. As much as possible, keep everything confidential between the two of you, unless there is a risk of safety. Also, take note of your body language. Do sit facing the person or beside. Give eye contact and show them by leaning forward. You also avoid sitting back with folded arms. Do not look around distractedly while the person is speaking, and don't leave while they are talking to you. Secondly, offer comfort and safety. Make sure the environment is safe. Help survivors meet their basic immediate needs such as food, blanket, or medication. Protect them from additional trauma and trauma reminders such as sights and sounds of danger and destruction or suffering. Then stabilize the client if there's a need to. Calm and orient them by using a calming and soothing voice. Give realistic reassurance such as saying what you are feeling is understandable. We are here to help and provide calming techniques that include cool washcloth to forehead, stretching, head roll, clench and release fists, and focus on slow, deep breaths. And if the situation rises, seek professional assistance, especially if the person states a desire to harm themselves or others, or they show signs of shock such as clammy ashen skin, rapid breathing and pulse, vomiting, faintness, dizziness, or extreme agitation. Meanwhile, here are some practical assistance we can offer to them. Clarify what they have told you about their needs and concerns. Help them problem solve and develop an action plan for next steps. Teach them some coping skills like deep, slow breaths, write in a journal, be with friends or loved ones, stretch exercises, listen to music, reach out for spiritual support, warm bath or shower, make a list of recovery actions, maintain a healthy routine, you rest, eat well, drink fluids, exercise, and avoid drugs, alcohol, or binge eating. You can also set a small goal for each day related to recovery actions and check off lists when done. With all this, the most important aspect one should have and practice to become a psychological first aider is the genuine compassion to help others. Be the helper one is needed. We hope you learned something from this. Let me just leave this quote from Lewis Carroll. One of the deep secrets of life is that all that is really worth doing is what we do for others. Thank you and hope to see you around Fatimania.